Does the Vampire Facelift work for small eye bags?
Thank you for your question. You're asking if the Vampire Facelift can be helpful for small eye bags. Well, I can certainly help you with this question, although you did not submit a photo, but it's a very good question. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice for over 20 years. The oculofacial plastic surgery is my specialty after completing residency training in eye surgery and specializing in plastic surgery around the eyes, which is where I treat eye bags pretty much every day of my practice for over 20 years. I'm also a member of the Vampire Facelift Network of doctors, and I have been a resource for media occasionally when questions arise about the Vampire Facelift, which has been quite a viral entity for many years. So when you submit a question and you state that you have small eye bags, it's very important to understand first, what are eye bags and what causes them? Well, most of the time we can say that eye bags are related to a genetic source. This is where fat pockets, which are normally behind the eye, push forward and create this bulge. Now, prior to a few years ago, the definitive procedure was a surgical procedure. But thanks to fillers, we're able to camouflage under eye bags non-surgically. So when you ask the question about a vampire facelift, let's be sure you're clear about the definition of vampire facelift. Vampire facelift is a combination approach to facial rejuvenation using a combination of platelet-rich plasma, which is activated, called platelet-rich fibrin matrix, with the intention of improving skin quality. In addition, it is the application of 1 syringe of a hyaluronic acid filler. So, when I treat someone who has very slight puffiness under their eyes, but often it is in addition to having discoloration, sun damage, fine lines and wrinkles, I will routinely do a combination of a hyaluronic acid filler to fill in the tear trough area to help soften the transition, as well as the use of platelet-rich plasma to improve the skin quality. Now, in order to determine if you're a candidate, you actually have to see someone in consultation. Just like facelifts or loose skin, most people tend to underestimate the degree of their under-eye bags. It's subjective when you make a statement like small under-eye bags. If they are small enough, you are a candidate for a hyaluronic acid filler as well as potentially platelet-rich plasma. But if you're looking for a solution where platelet-rich plasma alone, which is often misinterpreted as being the equivalent of a vampire facelift, then platelet-rich plasma alone will not do anything for under-eye bags. It'll improve skin quality and texture, but it will not on its own. Hyaluronic acid fillers have a limited value as long as the under-eye bags are slight. I can't tell you how often I help patients who come to me from everywhere with the overzealous placement of hyaluronic acid such that they end up getting various irregularities under their eyes, and often it makes their under-eye bags worse because a doctor is trying to help them by camouflaging and because they want to avoid surgery. Under-eye bag surgery in our practice has become very, very straightforward for the majority of people who come to see us. We do these procedures under local anesthesia with light IV sedation in an office operating facility, which basically makes it not that different from getting injectable fillers. Yes, it's surgery, but in this scenario where we're able to minimize the formality of an operation, such as going to a hospital or surgery center, as well as maximize the safety and standards of sterility, etc., like a hospital surgery center, we're able to really make this a procedure that is pretty straightforward to experience. In fact, I often combine under eye bag surgery with platelet-rich plasma as well as laser to help maximize the appearance under the eyes. So essentially, a consultation is critically important in order to establish whether or not you're a candidate for any non-surgical procedure. But it has been my general experience that when someone has perceptible under eye bags, very often it's bigger than can be treated alone with fillers. We always have to use good judgment on when to use fillers and when not to. And when someone like myself, who's a surgeon and does injectable fillers, I have no bias. A lot of times patients go to non-surgeons and end up getting volumes of filler to try to blend their under eye bags, and they end up looking not as good as they hoped. So I hope that was helpful. I wish you the best of luck. Thank you for your question.